My name is Patience Pierce. I've had back problems probably about 15 years now, and I've gone through physical therapy and S1 injections for my herniated disc. It didn't really help, it just more masked the problem. I was asleep about 3:30 in the morning. I was awakened with what I thought was one of the most severe muscle spasm in my entire right leg. I was almost screaming. I was in tears. And by Monday night, I started losing feeling in my toes. So Tuesday morning, when I went to get up, I had no feeling in the bottom of my foot and up the entire back of my leg.
Mrs. Pierce, she had an MRI, and it showed that she had, at the last segment in her spine, at the lumbar 5 sacral 1 segment, she had a herniated disc and some compression of the nerve that goes down her leg. And we thought, since she had failed these conservative therapies, she was a good candidate for endoscopic transforaminal microdiscectomy. This is a technique that's been, I believe, perfected over the last decade, where a small incision, a couple millimeters, is made on the back. Tubes are placed close to the disc, where we can then look at where the nerve is being pinched and where that herniated disc fragment is causing her symptoms. By doing this, we can avoid relatively longer incisions. This treatment is really the smallest, least invasive procedure, and it's done all through very small cannulas or tubes. When we do this, they go home the same day. Or up and about, obviously, the same day. They go home. They have a whole lot less pain than they would have if they had had a several-inch incision to do the same thing. We're returning them to work, depending on their job, of course, much sooner than we would have with the traditional open operations.
Oh my goodness, I have not felt this good in years because my back no longer hurts. And these are discs I didn't know I had problems with. They're not the disc that I took the prior therapies for. So I'm just amazed, absolutely amazed. I've even bought a bicycle because now I feel that I'll be able to resume some of the things I haven't been able to do in so many years.
What's special about the MUSC Spine Center is it's composed of, from the top down, from specialists from every field. We have pain physicians, we have physical therapists, we have physiatrists or rehab specialists, and we have surgeons, surgeons that are trained both in orthopedics and in neurosurgery. It's truly a very multidisciplinary team.
The relief is just amazing. It's improved the quality of my life so very much, and I will ever be thankful for that.